Welcome to No Filter Healthcare Podcast. This is where reality meets medicine, raw, unscripted, and uncensored. Co-hosted by healthcare aficionados Taylor Dunn and Tamara Donda. Ready to deep dive into the heart of healthcare? No filter, just facts. Let's get started.
Welcome to No Filter Healthcare. I'm your co-host, Taylor Dunn.
And I'm your other co-host, Tamara Donda. And today we're joined by Dr. Lou Shuman, who is the CEO of Cellerant Consulting Group and a pioneer in dental technology. I can say that. He definitely is a pioneer. He's also the co-founder of Lightforce Orthodontics. He introduced the first fully customized 3D printed orthodontic bracket.
Good job.
Insane. Recently, he also earned the Denobi Pinnacle Achievement Award, soon to be named in his honor, and was recognized among the world's top 100 doctors by the Global Summits Institute. Dr. Shuman also pens columns in Dental Economics, Dental Products Report, and Oral Health Canada. Additionally, he initiated the esteemed Cellerant Best of Class Technology and Hygiene Awards. Welcome.
Hi, nice to see you all. Thank you for inviting me to your podcast.
Of course, great to have you here, Dr. Shuman. And I hope one day that I have just, even a portion of the type of bio that you have. It's pretty impressive. And for anybody listening, we had to actually shorten it. So there's more.
Oh, yeah.
Well, very kind of you. I appreciate it.
Yeah, but so I get the privilege of actually meeting with you a few times a month. And so I'm excited to have you on here and share your insights about technology innovation in dental and things that you're seeing that are coming up that we can inform people about. So, the first thing I wanted to kind of talk about. So, Dr. Shuman, you have a rich history of fostering innovation in the dental industry, as we just mentioned. So, especially with your role with Cellerant. So, can you share with us how you identify and nurture groundbreaking ideas in the dental space?
Sure. Actually, let's divide that into two based on your question, which is to identify and then to nurture. So we are approached by many companies and we say no to many as well. You should know that. The first thing we'll do is we'll vet the technology itself. So between my own background and I'm blessed with an amazing clinical team, both in the hygiene area as well as in the dental area. And the technology will go to them. They'll take a look at that, which is very important. We'll look at the space to see, is this something that's a breakthrough? Is it when we're in a space where it's going to be competitive? We will vet the management team. That's part of my job. And that's a very important piece to this. When someone says to me they're the next Amazon, I go, thank you very much. Next. Or they go, we're going to launch an optical, veterinary, and dental all together. Oh, that's nice. Next. So, you really need to have a management team that understands that this is not easy and that there needs to be significant focus, and that's very important to us. As you guys know, based on your own backgrounds, great management teams can grow many different things based on themselves. So we look for that. Do we feel that this is a management team because we become so close with them that we feel are as successful as their potential technology? We also look to see if at early stage, because that's a lot of what we do we think they're fundable? Because, we're divided. We look at these companies three ways: creation of the product, launch of the product, and scaling of the product. And there needs to be funding along the way. So that's very important to us. So that's sort of identifying them, nurturing them. I always ask my potential clients the same first question: what do you want to be when you grow up? And they first laugh, and then they realize how important question that is, because we need to know, do you want to run your company for 20 years? Do you want to get acquired? Do you want a distribution agreement? You're looking for royalty? That's very important to us because we will tailor our whole relationship with them based on what their end goal is. And so, we'll nurture it through content. We're blessed that we have significant content capabilities, and we're the largest provider of content in the dental industry itself. So that's a great way to nurture. We'll look at strategic opportunities. We will literally sit down with them and do an 8-hour whiteboard session. and from that, a very, very specific operating plan. And so that we meet weekly. We're focusing on how we grow them at all different levels. If we need to or want to bring in key opinion leaders to support, we'll do that. And then we need to really make sure that we feel that we can approach the community that can grow it, because the community's divided in two in dentistry. We have our traditional community, which is about half, and our progressive. And so we'll want to nurture their ability to grow by looking at individually how we grow in each marketplace. That's sort of how we identify and how we start that initial nurture. But again, a very, very specific operating plan. This is not, hi, we're a consultant, let's shake hands and start to work.
Right.
We really like to look at, and with more mature companies, it can be different. Like in my case with that we get to work with you, with the level of sophistication that your team has, our goal will be to support. Sometimes we are actually the marketing department. In other situations, we're supporting it. So we really look at the detail of how we can best maximize what we bring to the table in integrating with each company that we work with, which, by the way, we have 33 companies that right now that we bring into the space from all over the world.
Wow. No, it's a great question that you ask, and it is funny. But I wonder, some of these early stage companies, if they even think about that question or ask themselves that question until you present it, because it is something to think about the future in that way.
Yeah, and you're absolutely correct that sometimes the answer is they don't know.
Right.
And so that's a great question. So we'll go into the space starting to see ultimately where that goes.
Right.
So if there is no answer to that, well, we start nurturing and we start creating product and launching it. We'll see what opportunities will exist as we go forward.
Yeah. Well, and you also, when you work with companies, you give them access to different dental journals. So, right now I know you're working with various dental journals to discuss the future of dentistry. So, can you share some insights on the emerging technologies that you think will be shaping the future of dentistry?
Well, that's what gets me excited to go to work every day. I love startups. I love the fact that we get a chance to look at these technologies sometimes a year or even 2 years before they launch. So I had mentioned when we had initial discussion, I could spend the whole rest of the day talking about emerging technologies that I'm excited about. But just a few of them. One is actually not launched at it. It's called OptiSurge. I think it will have a huge impact on the industry, especially for the DSO environment. And the best way to explain it is, let's pretend that we're a DSO and we have remote locations. I'm an orthodontist. It's really hard for me to get out to that location. What this technology does is, let's say there's a GP in the chair and they want an orthodontic consult, and I'm the orthodontist that comes once every couple of months. They have this server and they put on this pair of glasses that are amazing, incredibly clear. They zoom, audio, video, and I can plug in right here from Virginia. They can be in Utah. I can plug into the server and I am looking at that patient as if I'm in the chair with them. And I can do that consult from my home while looking at that patient. And so I can say, let's bring the periodontist in who's in Texas. And all of a sudden we're doing a multidisciplinary consult with a patient that is not even close to our locations. The other thing that I love about it is you can do education. So let's just say I'm going to do a lecture on Lightforce, which is one of the companies that I co-founded. We could literally plug a whole group in somewhere. I can tie in through the server and do a CE lecture while they're there, while just being on my computer. So OptiSurge, it comes from medicine, from a surgeon. She's amazing. We're working on bringing that to dentistry. There's an example.
I can imagine how amazing that would be even for small communities, right? That are kind of in the outskirts that don't have the, availability of care
Mm.
or I mean, wow, that's amazing. I'm excited for that too.
Exactly, exactly, and working really hard to get that to come to market. ORACUE, as you know, we're in an AI revolution right now. Um, a lot of it is focused on diagnostics. There's other ways that AI will impact dentistry in a significant way. This one I'll bring up is ORACUE. They are an AI software company, but their focus is patient conversion. Dentists in general are challenged in converting patients. It's something that that we always try to learn how to be better at communicating with patients and getting them to understand their needs and to go forward. So ORACUE is an AI software that the patient fills out all sorts of information ahead of time. That information then is fed into, once the actual clinical exam is done, is combined with AI, and the AI will tell the doctor what the patient is looking for, how best to communicate to that patient, and how to collaborate together. And it sounds like really interesting, but in clinic during our tests with it and our pilot, it increased conversion rates for the doctors from 40% to 70%, which is an enormous increase in getting the patient to understand their treatment and to go forward. So here's a way of using AI that is not, X-ray diagnosis, treatment planning software. Here's an AI that helps a relationship become closer between the patient and the doctor, walking and knowing ahead of time what that patient's goals and objectives are, and being able to team up together and come to answers that is a win-win. Love that. That's coming. Actually, that literally just launched last week. Whenever it was.
It's really smart because, then that they filled out the answers. It's not like you're fishing for that information or saying, "Oh, would you be interested in this?" They're already telling you that they want it. So, they know that it's going to be something it's going to be talked about. So, I think that's really cool.
Another one that I'm really excited about is you guys. I think that I think that Uptime Health is creating its own space in dentistry. When we look at new technologies, as I mentioned before, some of them are, how is it going to compete within the 4 or 5 technologies that exist, and then once in a while, and we have a few of those that are groundbreaking, that are going to create their own space. And I'm actually going to delegate this over to you, since I'm proud to be knowledgeable, but you are the expert. I'd like you to share what Uptime Health is doing, because I think it is a groundbreaking technology.
Yeah, and by the way, we did not ask you to plug us, so thank you for
No.
that.
Surprise.
Surprise. No, that's why we love working with you. You definitely work with some really great technologies, and we believe that about ourselves as well. So we are basically creating an environment for dental facilities to be able to understand exactly what they own. It's what we call the unsexy part of the business. It's not something that is really interesting to talk about when you're looking at, the money that you're saving, or you can actually understand what's happening with your equipment and it's all visible to you. And you can get things like how often it's breaking down. You can dispatch a technician directly in our tool. You can have depreciation value. You can track your compliance. And it's all from one tool that can be accessed even on your mobile device. I mean, I'm really excited about what we're doing, and it's constantly evolving and adapting to the needs of the industry. So I just feel like visibility is key for your business to be successful. And so we're trying to do that at Uptime Health.
That's what, and you're doing a great job. It's having a huge impact, and will continue to in the industry. Because not only are you getting, the community interested, but actually the corporate community is recognizing the importance of this, even within their own companies. so that you're getting to open the door to many different opportunities within dentistry. I'll give you one or two more quickly because we could spend all day. This is way too much fun. Um, Here's one, four-time best of class winner, actually, Nobio from Israel. They have come out with an antimicrobial technology called CASI, QASI, quaternary ammonia silica. And why this is a groundbreaker is in dentistry, one of our biggest challenges is doing composite restoration, especially in the posterior. Problem with composite is it's been very easy for decay to get underneath them. So secondary caries is a very big issue in dentistry. You mix this antimicrobial, which is FDA cleared, into composite, it prevents secondary caries from occurring. It actually kills bacteria. It does it through electrostatic technology as an antimicrobial. It's going to have a huge impact in dentistry. To be able to, and it's non-leaching, it doesn't diminish, and so it's constantly killing bacteria, blowing through biofilm, and all of a sudden that composite that you've done is going to last for a very long time because this antimicrobial has been integrated into it. We're going to see it introduced this year with a number of dental companies and a number of different products. What I always like to say about it is there's a very famous TV commercial by BASF, and that commercial says, "We don't make the product, we make the product better." And that's exactly what Nobio will be doing for dentistry by bringing that antimicrobial into some of the products in dentistry. I guess last one. This one's from Switzerland, and they used to be called Lamendo. Now they're called ODNE, ODNE, which is endo backwards. Okay, fine. I didn't do that. But they're called ODNE. But this is an endodontic technology that takes half the steps of doing normal endo, but more importantly, you can redo it. So that if you're doing a root canal and there's an issue, this actually can be redone. It's first of its kind. It's amazing. Companies are flocking to this technology. We're about a year away before we even launch, but no one's ever come up with something that can be redone in endo. And they're able to do this half the steps, so it's easier to do. That's about a year away. So there's a few of them. Like I said, we could spend all day. A toothpaste that has the ability to kill the oral biome, to kill bacteria from cellular. You ready for this? From spruce trees from Norway.
Wow.
That has cellular fibers that removes plaque and biofilm. Through that, it's crazy. It's about a year away. All right, we could do this all day, but hopefully there's a few.
It's moments like this where you just realize like how smart people are, and it's amazing what they can come up with. I'm really excited for these products to come to market. So thank you for letting us know about some of these exciting technologies. All right, last quick question from me, and then we'll let Tamara get into the conversation here. I've been hogging the conversation, but we've talked about this on a few different episodes, but I'd like to get your opinion on it too. Everyone's excited about the future of dentistry involving more AI tools. So, what's your hashtag no filter opinion from the perspective of a dental business owner on AI?
Yeah, let's talk about AI. The best way I can start with talking about AI is to take a step back. When SEO came into our industry, and we all thought how amazing this was, and all of a sudden there were all these experts, and it was challenging because we were promised a lot of things, and there were companies that saw they could take advantage of us as a profession because we didn't understand it. And there was a lot of issues. Today now we've woken up and have a better understanding of what it is. I mean, I still remember my brother calling me going, he's doing SEO and that he wanted to know if he should do the advanced SEO package. And I said, well, what's in the advanced SEO package? And he said, I don't know, it's more money, so it must be better. And That was the problem, is that we didn't understand it, and we were taken advantage of. Here, the level of brilliant people that are coming into dentistry and AI is outstanding. I mean, I'm going to mention names: Carl Stanley, Warda Inham, Alex Sanders, Florian Hillen, Eric Pulver. These people are all representing all sorts of AI companies. They are all brilliant. We are so lucky to have them come into dentistry. This is true innovation. Um, will it take time for the bell curve dentist, the individual practitioner, to understand it, adopt it, recognize their capabilities? It will. Just true, like with anything that digital workflow took some time, you know, but you see the impact immediately because the management teams and DSOs immediately see the benefit. So that opportunity, just what practice management software companies are like lining up, going, this is enormous. Insurance companies, and so there's a huge opportunity here. As you know, a lot of the focus has been diagnosis, treatment planning. Some of it, just like with a lot of the technologies, just you've got your early adopters, you've got your tech geeks. They take one look at this and love it. It's going to take a little bit more time for it to get to the everyday practitioner, but here it's having a huge impact because these companies are real. These leaders are brilliant. And we're very lucky to have them, and it's going to have a huge impact on dentistry. And I'm very happy that it's not an SEO, here we go again. So to mention those companies: Pearl, Diagnicat, Vidya Health, Denti.ai, Overjet. All of these companies are bringing great value to us, and there'll be more. I mentioned ORACUE. These are all, and what I'm excited about is we're going to start to see AI grow horizontally, where there's been such an emphasis in one area, that AI will start to spread into other areas and impacting us. And very excited about that. So there you go.
Love it. I'm all about AI.
I hear
I could talk about AI all day, but no,
you.
I think you named the greatest. I mean, truly. So yeah, and I think it's just the beginning of AI. I think
True.
there's so much more that's going to happen. So excited for that. I'm most interested in the Cellerant Best of Class
Yeah.
Technology Awards. I know that you use this obviously to recognize innovative products, innovative companies. Can you share with us some of the most exciting technologies that have been recognized through this award?
So let me break this down into two. One is, let me share what is this award about, so that there's a better understanding of why it's reached its level of prestige. This is in its 14th year, believe it or not. Um, it occurred because I won an award 14 years ago, and I was working at a line at the time, and I thought I was going to get a big raise, and I thought I was doing the celebration dance, and I found out to win the award, I won 13-12 as far as who voted. So it wasn't the dental community. It was just 13 dentists that voted for me. So I said, you know what? Something's wrong with this award process in our industry. And I started to look into it. And there wasn't the kind of award that I was hoping we would have. So I created that award 14 years ago. It's nonprofit, it's unbiased, it's rigorous, it's transparent. I was blessed to bring in the top technology dentists in the industry: Marty Jablow, Paul Feuerstein, John Fluke, and then later Pam Maragliano Munez and Chris Salerno. They spend the whole year, and myself as well, looking at all technologies that exist in dentistry. And we also have on our website the ability for any company to nominate themselves in case we miss anything. We get together at the Chicago Midwinter meeting every year. We shut the door for 5 hours and we go at it. I mean, people ask me for the movie rights of what happens in that room, because it's a war. It's our reputation. It means a tremendous amount to us. And then after 5 hours, the smoke comes out of the chimney, and the white smoke comes out of the chimney, and we have our winners. It's the only award that's covered by every journal in North America. And that's because of the level of rigorousness that this award is about. It's considered today sort of the Oscar. We don't have a top 10 or top 20. I don't believe in that. It's not like, okay, gang, we have 17. We need 3 more for marketing purposes. If any of us is consulting for a company, we're not allowed to vote in the area. And then the last thing is we have no categories. The reason why is I don't want to pick a winner in a category if there's not a company that is heads and tails above the rest. This award is not about what's the most exciting technologies that are available. This is an award that we created that we want the dentist to know this is the technologies and the products that they want in their practice to use every day, that it truly makes an impact. And what's occurred recently is these technologies have become, some of them, really expensive. I'm emailed all year long going, are you going to tell us what CBCT is the one to get? What scanner? Because these are $30, $40, $100,000 now, separate of some of the small ones. But the key thing is that that's the kind of trust that we want to have with our community is here's what you should have in your operatory based on the amount of research and time we've spent to pick out what we consider as the best. I'll name a few because some of them have had huge impact, but you should get an idea. 17 winners this year, only 4 are first time. To be a multiple winner is extremely difficult. 3 Shape Trios, which is a scanner, is won for the 11th time. To win once, to give you an idea, the first 10 minutes we go through the winners from the year before, typically 50% of them are thrown out. And the other 50% just go back into the mix. So to win once is huge. To win more than once is extremely difficult. We're telling the world a technology that's won 11 times that everybody should have this scanner in their office. B&R Handpieces, the Nova, is a 2-time winner, but B&R Handpieces have won 10 times. Again, if you're looking for a handpiece, there is no other. You're looking for CBCT, the Carestream CS9600 is a 5-time winner. So we're trying to make the community aware that in these purchases, this is just not a great technology, but it is won so many times. This is the one you want in your practice. We talked about AI. So our 2-time winner is Pearl, Second Opinion, just so you know. And we're very proud of that. And then we have some newbies this year, the Sprint Ray Ceramic Crown, the Roland DG-shaped mill, and the Oroscopic Dragonfly are first-time winners. So that should give you an idea. Some of these companies, as a result of winning the award, are acquired. Some of them have garnered major distribution agreements. That's how important the award has come. It's a lot of work. It's a lot of blood, sweat, and tears. I created a 7.5-pound piece of art glass to reflect what the award means for the winners. And like I said, I'm very proud that it's covered by every major journal in North America as a result. So
Save a seat. I know it's happening, but save a seat for Uptime Health. It's going to come
well, this
any
year you'll
day
be
now.
evaluated now that you've
If you're
launched.
hearing this, vote.
And so, yeah, and as you know, since I have had the privilege to work with you, I can't vote.
Darn.
But
all of our listeners can.
no, but you're very, very excited about what you're doing. And of course, just like all, I mean, to give you an idea of the 17 winners, only one is a Cellerant client. That's something I always want people to know. This is not if you become a Cellerant client, you win. It doesn't work that way. We just had one. I'd like them all to be, but that gives you an idea of the level of rigor that this is in winning. So There you go.
I'm curious, would you ever have like a public voting award, like something where anyone can kind of cast their votes and then that's kind of taken into consideration in the voting room with you guys?
Yeah, so that's out there. I had a friend who did that for another company in that respect. And what was happening was the companies that were nominated were voting and then voting again and then voting again. And all of a sudden it lost it lost what the real goal and objective was. And so here, as you can see, I run a really tight ship around this. And that's one of the reasons why it's respected, because there's no money. If you're a consultant, you can't vote. No category, no 10 or 20 to make it a marketing thing. And I'm blessed with the most prestigious technology dentists in the industry.
Yeah, and speaking of all of the people in your team, I'm really curious how you found these guys. I mean, you have stacked up a team of just amazing people. What is your secret? I have to know.
um, I would I would like to say that the secret is integrity. Um, the I would like to believe that I've always been a person where words are not my success, but actions, and let them speak for themselves. Um, I'm not a promoter. That's not what I do. I work a really long day every day, and I do that because I'm dedicated. I love what I do, and I feel that the people that have joined me is because they recognize the integrity of what um, my companies do, what my background in that, and that's what's important to me and is important to them. I'm also not a believer in hierarchy. I believe that everybody is equal. When I ran my office, my part-time front desk person was on the same level as my doctors. Everybody is treated equally, and I think that's also a very important characteristic. Is everyone's treated the same. Everyone's given. I totally believe that you can learn from anybody. There's as much as I like to teach, I learn so much from everybody I get exposed to. And then the last piece is, while we're at it, is there's nothing I enjoy more. You're two examples of it, of people that don't come from dentistry that come into the profession. And I think that I try to bring that expertise into what I do and to the companies do, which ultimately educates and provides great benefit to my peers.
No, it's a great question, Tamara, and I've been thinking about it too. I'm like, you really have put together a great team of people, and they're recognized everywhere they go. So, Dr. Shuman, it was really great to have you on today's podcast episode, and a lot of great information, so many technologies to explore. So, if you'd like to learn more about Dr. Shuman and Cellerant Consulting Group, you can visit cellerantconsulting.com. And don't forget to subscribe to the podcast and leave some comments below. Thank you again.
Thank you. It was a pleasure.